Okay.
Those are the alcohol caps?
Yes. Okay, so after you administer the medication, you want to put a new one of these on. This keeps the end sterile.
Okay.
So once you take it off, though, you're exposing it, so you don't want to touch whatever's there. So what I would do is I would prep everything you need. You need 2 flushes and the medication. Okay? And this is kind of the order we do. We take off the cap, we flush it, and then we administer the medication, and then we flush it again. Okay? So there's a little valve here, little clamp. You undo the clamp, just like that, and you take this off. Take off the alcohol cap, and then these are the flushes. If you notice, there's a little air bubble in that. You need to get rid of that air bubble. So what you do is you pull back first because it's sealed.
No.
And if you were to unscrew the cap here and try and force that air out without breaking the seal, you'd squirt the sealing because it would just break finally.
Yeah.
Up you go.
Air bubbles will kill you.
Yeah.
A lot of air bubbles will kill you.
No.
But that little one, we just push it out just so it drips just a little bit like that. And
So what, you just went slowly to get the air bubble out?
So if there's an air bubble, I'll just put a little air in there. You can actually kind of see it. Just push that out just like that.
Okay.
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 All right.
Did Connie do this on Gail?
I'm not sure if she did.
Right.
I don't think so. Gail went in the hospital.
So what you do next is that we need to attach this. And remember, these 2 ends are sterile. So if you accidentally slip and touch them to something else, you're going to need to use the alcohol to clean it. But as long as you don't touch anything, and this is still considered sterile. So what you do is you push it in just a little bit and you twist it, just like that. Okay. You want to make sure it's unclamped.
Clockwise, okay.
And then you just kind of slowly press it. Now you want to monitor above this IV to make sure that it's going in. If you notice a large bubble or if he gets in a lot of pain, you want to stop.
Okay. And this is a saline solution?
Yeah, this is saline. We use this to kind of clean everything out, make sure it's flush and patent. So, and you can go kind of fast on this, but I'd go about that fast. Okay. And then we have the medication. Same thing. You take off the lid. There's a teeny air bubble. You push that out.
So then you'll come tomorrow night?
Yes, and we'll go through this again just because I want to make sure that you're comfortable doing this. And so what you do is that this takes 2 minutes to go through. So so you want to time it to where you just push a little bit in.
Okay. So it's 2:51 now.
Yep.
So we'll go till 3:51.
So you give 1 or 2 of the
It's
lines
2
here.
minutes. Okay.
And then you wait 10 or 15 seconds, and then you go again until you use all the medication. Should take about 2 minutes.
Okay.
Okay. When you're done with that, you flush it, doing the same thing. Where you open it up, push the air out, and then you do that too. You press it in kind of fast, and then you use an alcohol cap, and you put it back onto there. Okay. And that's it. It's pretty easy. If I can do it, anybody can do it.
Okay.
Okay. So it's been about 10 or so seconds. So you just press in another line or 2, nice and slow, just like that. Okay. So all in all, you want this to take about anywhere between 3 and 5 minutes.
Oh,
basically.
okay.
Sorry, not 2
Between
minutes. Yeah,
3
to
and
5.
5 minutes. Okay. So we started at 2:50. So we're
2:51.
Is that my blood we're looking at?
Where? There's no. I don't think there's any. There might be a teeny bit there from.
You said between 3 and 5 minutes.
3 and 5 minutes. Yeah,
Okay.
just
We
just
started
kind of
at 2:50.
So how many days does this go on?
You've got, you want to do this every single day. There's 1, 2, 3, 4, 5. There's 6 more, so you want to do this over the next week, every day for the next week. And then depending on what the doctor says, we'll probably deliver out more, just because we want to make sure we get all that water off. Just like that. So you just go nice and slow. Okay.
It's been 2 minutes now. We've got another minute or 2.
Yep, and we're right there at halfway mark. So that's about perfect. So, and I've been looking at the clock behind you because it's got a second hand. So
Okay.
about every 10 or 15
I'm
seconds.
looking at my the video. You've been timed.
Any questions so far?
So when can I go to bed now?
Just whenever you want.
Might have to get up a lot.
You might have to get up a couple times to go to the bathroom. So this stuff is pretty potent, so you should start to feel it here pretty soon.
So we'll do one of that, and then we flush it after it's done. And that's a saline, just a saline solution.
Yeah, yeah.
Okay.
And so there's an acronym you want to remember. It's called SAS. So saline, administer the medication, or A, and then saline again. So SAS, and you want to do that every single time.
And those are the lids that go on it?
Yeah, these are the alcohol caps.
So do you have a written list for all this?
I do actually, and it's in the paperwork that we brought by, and we'll go through that here too.
And I've
Okay?
got it on video too, so
And we have it on video.
we'll put it on YouTube.
Okay. And like I said, whenever you flush this for the first time, you want to make sure that we don't get what's called infiltration, and that's where the catheter inside the vein kind of pops out, or it ruptures the area. So if you notice a big bubble forming right here as you're pushing the saline, or during this whole process, if you notice a bubble, you want to stop and give us a call. Or if there's any kind of pain associated with flushing. Okay. And the cover will go on here, and it'll be this little sleeve right here.
So can I call you at midnight if something goes wrong?
You can call me at midnight if there's something goes wrong. We are available 24/7.
Okay.
All right, another 10 seconds and we'll be done with the medication.
Where do you live?
I live in Rose Park,
Rose Park.
but we have nurses all over the valley, and I work the night shift. Okay, so I'm going to actually have one of you do this part.
Okay.
Okay. All right, so go ahead and use some
Okay.
Avogard.
Okay. So just
Before
wash
and
your hands.
after, right?
Yep. Wash your hands, use Avogard.
Okay.
Just because we want to make sure things keep nice and clean.
Okay.
Okay, so I open the package now. Just go ahead and pull back to break the seal. Pull back on the plunger first. Just kind of pull back until it snaps. There you go, just like
Okay.
that. Okay, take off the cap, and then just remember that
Get the
tip
air
is
bubble
what.
out?
Yeah, that tip is what's sterile, so you don't want to touch that. So just go ahead and just gently push that until that air bubble goes out.
Okay. Is that
Keep going. There you go. Perfect.
okay?
If you lose a drop or two, it's not going to hurt. Okay.
Okay.
There you go. Okay.
Looks like there's a lot of air bubbles coming
No,
out.
that's water actually.
Okay.
Okay, so go ahead and unscrew that one. Perfect. Now you want to be really careful because
Oh, don't touch it?
No,
Okay.
you touch the outside right here is fine.
Okay.
You don't want to touch that. So go ahead and press that in. Go ahead and grab that.
Okay.
Push it in. Push. There you go. No twist. There you go. Keep going. There you go. About a half turn. There we go. Perfect.
Okay.
Okay. Now go ahead and just start pushing some of that in.
Okay. Let's go really slow at first.
Yeah, I'd go a little slow at first. You go a little faster than that.
So that's Dr. Colosimo.
There you go. Perfect. Okay. Now, we want, because this is the end flush, we want to clamp this as soon as we're done pushing.
So it doesn't get any air in.
Well, that way we don't want blood to flow back. So that's why we clamp it. So,
Okay, and it's just
yeah, but you can push faster now. There you
Okay.
go. Perfect. Okay, so if you notice, there's no bubbles or anything showing.
Okay.
So when you're about to 1 or 0, you want to clamp that. And
Okay.
You want to press while you're clamping it.
okay.
So.
When you're about to 1 or 0 on here,
Yeah, and you can see.
where can I don't see where the scale is? There we go. Okay.
So go ahead and keep on pressing. There you go.
Okay.
Perfect. Just like that. Just all the way down.
Yeah, she has some experience now.
Go ahead and
Taking-
clamp that.
There you go. Is this clamped?
Yep. You're
Okay.
clamped. Okay. Now, if you try to press the rest of that, notice
It won't go because
yeah.
it's clamped.
Yeah.
Okay.
And go ahead and try it. I want you to feel what it's like. Feel how it just won't
Yeah.
move at all.
All right. So that's clamped good.
Yep. Go ahead and take that off.
Okay. Hold on to this.
Yeah.
The blue.
Yep.
Okay,
There you
and
go.
then this is discarded.
Yep. And then
First get an alcohol cap.
Yep. And they just pull off if you rip it away, like from here. If you rip it that towards that
Okay.
way. Go-
So
you
I
can,
don't wanna
You can
put
drop
this
that.
in.
You can
Okay.
drop that now because we're going to sterilize it. We don't.
Okay.
Okay. If you look, there's a sponge and
Mm-hmm.
that's full of alcohol. So go ahead and just screw that bad boy on. Just like that. Perfect. Doesn't need to be too tight or anything. And it doesn't matter which side you use.
Okay.
Okay. Yep. Okay. So,
So
and that's,
now we have the, okay, so this, and this goes in the.
we can just throw that in the garbage. There's no,
Okay.
there's no
Oh,
nothing.
okay,
Just,
nothing, no medical waste, just the,
yeah. And then if it's something that's sharp, like to stick you,
Right.
you want to throw
That's
it
in
away.
our hazardous
But
waste.
yeah, and that one you don't need to worry about because if we ever use that, it's going to be from starting IVs. So,
okay.
and then we've got the sleeve. You still your arm for a second. Okay. And that is how you do it. Any questions? And we'll come out tomorrow and we'll walk you through
Okay.
this again
Okay.
because our job is to make sure that you guys are comfortable doing this on your own.
Okay,
All right?
okay, so